on now that I'm here on my own? Good afternoon, John Knox Village, and welcome to this very special edition of our Wellness Wednesdays series. Not only is this our first virtual broadcast of Wellness Wednesdays, but given that we have 5 Wednesdays in the month of July, we actually have the privilege of having an extra presentation. And today we have with us the wonderful Dr. Neil Amin. If you are having trouble wondering or remembering how to pronounce his name, think of it like amino acid, Dr. Amin. Dr. Amin is double board certified in anesthesiology and pain medicine by the American Board of Anesthesiology. Dr. Amin underwent his pain medicine training at the University of Washington Medical Center in Seattle, which is the birthplace of our modern pain management in the United States. So we're very lucky to have Dr. Amin here with us today. So without further ado, I'm going to turn the screen over to Dr. Amin. The presentation today will be about 20 to 25 minutes long, and at the end there will be an opportunity for question and answer, because I'm sure many of you do have questions for Dr. Amin, and he's more than happy to answer them for you. So enjoy the presentation.
All right, thank you so much, Jackie, and thank you for John Knox Village for this opportunity. And I look forward to educating you today on regenerative medicine. So to start out, regenerative medicine is kind of the new wave of treating chronic pain. My goal as an interventional pain specialist is to treat your pain, not just mask it with pain medications or send you straight to a surgeon, but we try to do in-between procedures to relieve your pain. So at our practice, we have a traditional pain practice where we use things like cortisone and gels and fillers to treat your pain. But now we're moving in a new direction, which complements the traditional pain practice, and that's called regenerative medicine. So we're gonna talk about that today. So nice to meet you all, and here we go. So today we're going to talk about stem cells and PRP, which are 2 main components of regenerative medicine. And the idea with regenerative medicine is that we want to take you up the cascade so that we actually regenerate and we create new tissue, ligaments, bones, and we want to treat your chronic pain in a new and modern way. I just want to start out by saying that that's my contact information. And at the very end, Jackie has graciously stated that she can put you in touch with us, and I'm happy to do a telemedicine conference with you individually. So I just wanted you to know that, and we're going to start our conference. So the first component and the first kind of product that we use in regenerative medicine is called platelet-rich plasma, which the abbreviation is PRP. Now, PRP actually comes from your own blood. So the beauty of this treatment is that it's your own cells creating the regeneration. Now, you've heard about plasma quite a bit, especially during this COVID-19, because the plasma is the liquid part of your blood, and it's made up of water and the proteins. And the proteins are which are the magic in PRP, because they are different kinds of products like tissue factors, growth factors, cytokines. And what it does is that the plasma allows the red and the white blood cells, as well as the platelets, to move through the bloodstream. And the proteins that are in the plasma are the best healers and the best anti-inflammatories in your body. So we really value plasma in the medical community. And now through the advancements of regenerative medicine, we can actually offer you these plasma treatments in the office within about a 20-minute time frame. And we'll explain that later in this talk. And also the second component of the PRP is the platelets. So the platelets are the type of blood cells that allow you to clot. So whenever we heal something in our body, the first job is the platelet recruits and actually begins that healing process. So with the PRP, you have the plasma, which I stated is in nature's best healers and anti-inflammatories. And then you have the platelets that actually initiate the healing process. So here's a typical sample of blood that we draw from you. So as you can see in that tube, we only have to draw about 10 milliliters of blood. And from the 10 milliliters of blood, we get about 7 milliliters of plasma, which is there in the yellow. And we call plasma the liquid gold because it literally is the best cells in your body as well as your stem cells. But no matter how old you are, your plasma always has the capacity to heal and the capacity to regenerate, versus stem cells, as we get older, they don't work as well. So plasma is a very powerful tool that we all can use at any age. Now, the nice thing about PRP is that you literally can use it on any part of your body. So I have a picture of here. So for example, in the foot, if you have any kind of disorders of your ankle, if you have any plantar fasciitis, if you have arthritis of the big toe, if you ever have gout, if you have any kind of tendon injuries that just aren't getting better, if you have any bunions, these are all things that can be treated with PRP. If you look at the top left of your screen, I showed the knee joint. So all joints are surrounded by a capsule, but there's also the joint itself. And a lot of doctors only pay attention to the joint and they forget about the surrounding capsule. So we really focus on our practice is treating every part of the joint and not just focusing on one thing, which most people just focus on the joint. Now, we can actually do PRP for the hands. I'm going to show you some rheumatoid disorders that we can do it for. We can do it for carpal tunnel. We can do it for tennis elbow. We can do it for basically any kind of pain that you have in any part of your body. So I put this screen here to remind you that the potential of PRP is infinite. So how do we get the plasma? So it's really easy now. With the technology that we have, it's very easy to extract plasma. So you come into the office, we draw 10 milliliters of blood, so it's a relatively small sample, and we put it into a centrifuge machine, which I'll show you a picture of that. And within the tube, there's a product called a gel separator. So while the machine spins the sample, it only takes about 8 to 9 minutes to do the spin. And then it separates out the red blood cells from the plasma and the platelets. And if you go back to this screen where the lady is holding the tube, that is how it ends up looking in the tube, where you have the red blood cells on the bottom, and you have that thin layer that I told you that helps separate out. And then the top is what you have, the plasma. And then we take the plasma out of the tube, and then we can inject it in different parts of your body. So the whole process is actually very easy. You come into the office, we draw the blood, we put it in the machine, and you're usually in and out of the office within about 20 minutes. So this is a machine that I just wanted to show you. This is the centrifuge machine. So there's the tube of blood that we drew from the patient. We placed it into the machine for 8 minutes, and then we removed it, and that's how it looks. Now, one trick, if you ever decide to get PRP, and something to remember, is drink a lot of water before you come. Because the more water, as I stated, plasma is made up of water. The more water you drink, the more plasma that we'll get. So you'll see less red blood cells on the bottom of the test tube there, and you'll see more plasma. So it's a little trick to remember whenever you get this treatment. So how does it help? So PRP is kind of it's a protein-packed shot. That's how I explain it to my patients, that it is full of all of the best proteins in your body. So an example I often give to patients is if you scratch your arm and you generate a scab, it's the platelets and the proteins that create the scab. And then you notice that within about 7 to 10 days, the scab falls off. And then probably another few weeks later, you'll see that the scar is totally gone. That whole regenerative process that I just explained to you is done by your plasma and your platelets. So that's why PRP is so effective in treating different kinds of injuries and different things that cause pain. So the primary purpose of the PRP is to recruit and to transport nutrients, hormones, and proteins to different parts of the body that need it. So your body constantly delivers plasma to your body all the time. You know, it's very common that you could walk up the stairs and you create some pain, and then maybe in like 2 or 3 days, the pain is gone. Well, that's what your plasma did. Your plasma fixed that little micro injury and you got better. But at some point, those little micro injuries can turn into larger issues and chronic issues, and your blood vessels aren't able to deliver a good volume of this plasma and platelets to that area. So this is a way of basically delivering a large volume of these cells directly to the injury, so that you create a very quick resolution to that injury, and it can avoid a lot of unnecessary surgeries. So the PRP contains a lot of growth factors and cytokines that stimulate the healing of soft tissues like muscles and ligaments and tendons and even your skin. So the PRP does this because it stimulates specific cells called the fibroblasts, and this creates new collagen and elastin cells. So I showed you this slide because a lot of doctors, as I mentioned, they only focus on joints. And in our practice, we really pride ourselves on focusing on everything. So for example, if you look at this slide on the left, this is, if you look at right at that area at the kind of in the hip and buttocks area there, a lot of people get a lot of pain in that area, and it's very debilitating. I see people that end up in wheelchairs and walkers over this, and it's something that I've been kind of treating in the last 2 years with PRP, where the patients, they state that when they, for example, get into a car, or if they walk for a few minutes, they get this sharp pain and this instability in that area. And I've noticed that when I put PRP into those muscles, specifically in the gluteal area, it rebuilds those ligaments and tendons, and the patient has tremendous confidence in not using a walker or a cane. For example, in the knee on the bottom there's a very common, between the meniscus, which is a cartilage that holds the knee joint together. It's a tremendous source of pain that does extremely well with the PRP. And if you look on the right, I was demonstrating there to you that your shoulder, a lot of times people get unnecessary shoulder injections, but it's actually those tendons that all attach to the shoulder that generate these really large amounts of pain that respond beautifully to PRP. If you look at the disc, you notice on the left side, you have the purple arrow disc, but the blue disc and the red arrow disc, you see big protrusions right where the tip of the arrow is. And what they're doing now in Europe is they're actually putting PRP into the discs, and you can see that 11 months after the treatment, those discs have significantly gotten better. Now, this is something where I wanted to just go over some areas of treatments that the PRP does well with. So for example, in the shoulders, any kind of rotator cuff, tendonitis, partial tears, there's even the joint does extremely well with that. In the elbow, if you have any kind of tennis elbow or golfer's elbow and it radiates down into the arm, it does great. In the low back, you can treat hamstring injuries. You can treat sacroiliac joint, your SI joint, and the facet joints or the arthritic joints in the low back. In the hands, any kind of rheumatoid disorders where you have nodules on the tips of your fingers or on your knuckles, any kind of carpal tunnel syndrome does extremely well with PRP. In the knees, any kind of meniscus injuries, your MCL, your LCL, ACL, any ligament disorders, if you have any cartilage problems and arthritis, that does well. And as I mentioned, in the ankle or the foot, plantar fasciitis, Achilles tendons, and sprains. And one thing with PRP is that if you ever injure yourself and you don't want to wait 4 to 6 weeks for you to heal, for example, like a stress fracture, you can put the PRP over that area and it will speed up the healing process. So for example, for knee pain, in 2017, there was a study done in the Netherlands, and in that study, it showed that 85% of the patients had improvement in their pain after 6 months. Now, the one thing I wanted to bring up is that we use corticosteroids all the time, and it's not that corticosteroids are bad. It's that corticosteroids, they prevent us from going down the degeneration cascade. And so they prevent us from, preventing inflammation, so it doesn't eat away at the structures that are inflamed. But the thing that's the disadvantage of cortisone is that for those of us physicians that, do this on a regular basis, we're extremely mindful of how much cortisone we inject per area. So unfortunately, cortisone got a bad rap because in the 70s and 80s, people were just injecting cortisone unlimited, and that was not a good thing. In practices like mine, we keep a procedure list and we keep track of how much we're giving you. So that's really not an issue for us. We never have to ever have a conversation about steroids causing you side effects because we're very mindful of how much we put and in which area. But cortisone is not great for tendons. And that's the one thing that I want to drive home in this, is that if you ever see a doctor and you have a tendon problem, don't let them put cortisone over it, because that is the one situation where you can create a rupture and a weakening of that. And that is it's a much better situation to put the PRP. There's no risk of that. And it's really important for the knee, because in my clinical practice, I've learned that the joint is generally not the problem with knee pain. It's actually the tendons and the ligaments. So that's what the PRP does well with. Now, this is just an image I wanted to show you of a healthy knee versus an unhealthy knee. So what I wanted to kind of bring home is that you can see like the knee has a lot of pieces to it. If you look on the right, you've got nerve issues that can cause pain. If you look at the cartilage there, synovial fluid and the scarring of the synovial. The osteophyte formations are abnormal bony growths of the bone. We have to look at cartilage. And then this remodeling is something that, we'll talk about later in the lecture, but it's kind of some advanced things that happen with these knee issues. Now, even with surgery, you're going to fix that joint in the middle, but sometimes but all these other things that I just pointed out are not addressed through surgery. So a lot of times with patients, what I do is if they go in for a hip surgery or a knee surgery, I'll do a PRP treatment, maybe do 1 or 2 treatments before their surgery, so that you treat the surrounding of the joint and get it as healthy as possible so that it's receptive to the surgery. And so you basically take care of the joint, but all these things that I've outlined here are addressed. So it's another way of utilizing PRP as an adjunct to surgery, so that you treat the entire joint, not just one section of it. And I just want to show you, this is an example of, when we do injections at our practice, we do everything with some form of imaging. So either we'll do the injection under ultrasound, or we'll do the injection with an X-ray machine. So we always will visualize the joint just like in this picture. And then we find the area that's easiest to access. The procedures are actually they're not uncomfortable in the sense that we use numbing cream to numb your skin. We use acupuncture sized needles. We numb you thoroughly with some lidocaine. And the new PRP that we have does not burn like the old PRP does. So you may have heard from your friends and family that, the PRP worked great, but it was so painful. We don't run into that anymore because of the advancements in the new machines. So this is a nice slide because it shows that, again, I'm not throwing cortisone under the bus, but cortisone does not have the regenerative capacity that PRP does. So you can see where consistently the PRP patients reported more pain relief than the cortisone patients because of that regenerative component. And that especially is seen after 6 months. So the point is that you get a more definitive treatment with the PRP versus having to do repetitive injections throughout the year. So does PRP help cartilage repair? Yes. I just want you to remember that no matter whether you see me or any other doctor, you have to pay attention to the entire joint, not just one section of it, which a lot of people don't do that. So I wanted to talk a little bit about PRP and shoulder pain because, it's pretty common that I see this a lot in my clinical practice where patients get unnecessary shoulder surgeries, and it's because it was never the joint. It was always the rotator cuff and things like that. And the thing is that even when the surgeon does the repair of the rotator cuff or the tendon, it's a lot of rehab that the patient has to do to gain the function of that joint again. So as the picture I showed you earlier, where you see how complicated the shoulders and the knee joints are, I want you to always remember that, PRP is something that we all should introduce into our clinical practices because we really need to pay attention to that. If in a study that was done recently, at a 12-month follow-up, patients that received a series of PRP injections were 16 times less likely to undergo surgical intervention because they repaired the capsule, not the joint itself. So this is something that I wanted to just bring attention to you in my clinical practice, that I've learned that PRP does exceptionally well for these rheumatoid disorders. So if you notice his patient's fingers at the very distal joints, they're noduled and they are very debilitating because the patient can't open and close their hands at their leisure. And if you actually put some of the plasma and platelet PRP over these little nodules, within about 60 to 90 days, you'll see a great reduction in that. So to give you an example, my own mom had these nodules on her fingers and she was having trouble opening and closing her hands. I did a series of 2 treatments 3 months apart, and now her nodules are gone, and you would have never, her hands look like this and now they don't look like that. So it's pretty powerful. And I was just showing you that, this is kind of the stages of where we can take you from this rheumatoid picture on the right and reverse time and make you go to the left side of your screen. And if you look at this picture on the lower right-hand side, we can make you go up this ladder rather than going down that ladder. And then this is a nice slide because I wanted to show you how normal healing process is a 4-step process. You get a barrier, then you get good inflammation to do the healing, then you get tissue regeneration, and then you get tissue remodeling. But when you do healing with PRP, you can see that the time to do that shortens tremendously. And that's the power of the PRP. And I wanted to show you that on a slide to demonstrate that. Now, this is an image of where they, if you look at on the left-hand side, this is a patient that, if you see the arrows, he has a tremendous amount of inflammation on that left side of the elbow. And then after 3 months of PRP, you can see that inflammation, the bright white is gone. And that is probably something that would have probably lasted for about 9 months to a year and required a lot of rehab to get that better. But with PRP, we still want you to do rehab. It's just that it probably won't be as painful and the process will be quicker for you. So now let's talk about stem cells. So stem cells, now prior to this, I talked to you, if you notice, I talked to you more about soft tissues. I talked to you about ligaments. I talked to you about muscles. I talked about tendons. But stem cells is needed more for bones. So when we're trying to regenerate joints. Also, there's a lot of patients, they just like stem cells. So stem cells will do everything that PRP can do, but it just does it in a much more potent way. So what are stem cells? So stem cells are the most unique cells on the planet, because when a baby is born, you have the placenta, which delivers stem cells through the umbilical cord into the amniotic sac. And the stem cells that are in the umbilical cord, they have not committed to become any kind of cell. So stem cells are new cells for the body, and they specialize into becoming a certain type of cell. And they also have the ability to repair cells that are damaged. And the two unique properties of stem cells is that they can divide over and over again to produce new stem cells. And as they divide, they can change into any kind of cell of the body that they decide to become, to be. So in this slide, I want to the take home is that the stem cell has the ability to develop into specialized cell types. So once that stem cell leaves the umbilical cord and it gets into the amniotic sac, at that time, once it's in the amniotic sac is when it decides, I'm going to become a hair, or I'm going to become an eye, or I'm going to become a toenail. That's when it makes the decision. But when it's in the umbilical cord, that cell has not made the decision as to what it's going to become. And that's important in the next up and coming slides. So the unique thing about stem cells is we can take stem cells and multiply them to make more stem cells, which is on the right of this slide. And those are the cells that have not committed to anything. And those are the cells that are in the umbilical cord. And then if you go down the slide, this is where they're in the amniotic sac and they are becoming to commit, whether to be a nerve or a muscle or a red blood cell. So that's the distinction. So where do they come from? So there's a lot of misconceptions about, whether stem cells are ethical or not. And I want to kind of clear that up so that everyone leaves this conversation knowing that that's not true as far as it being unethical. So the modern way of how we're acquiring stem cells is that we don't go into the patient's bone marrow like we used to do that, because it's pretty well known that after the age of 50, our stem cells are not as potent or as strong, because that's why we age. Our hair turns gray because our stem cells that make the color of our hair have become dormant. Our knees give out because the stem cells that regenerate the structure have become dormant. But by injecting new stem cells into these areas, I'm not saying we're going to make your hair colored again, but but I will say that we can actually regenerate joints and ligaments and tissues through stem cells. And the way we now acquire them is, I talked to you earlier about the umbilical cord, is that American mothers who have been screened through lab work have the option of selling their umbilical cords to companies that then extract the stem cells out of the umbilical cord. As I stated, those umbilical cord stem cells have not committed to becoming any kind of tissue yet. And those umbilical cord stem cells do not have DNA, therefore they do not carry diseases. So they are really nature's ultimate anti-inflammatories and regenerative cells. And once the umbilical cord is clamped off, it immediately is frozen in nitrogen, and then it's shipped to the lab. The labs then unfreeze the umbilical cord. They count out 1 million of the stem cells. They place it into a vial, and then they freeze it again. So the stem cells that you're delivered from our practice, I can't speak for anyone else's practice, those stem cells are about 5 hours old. So you are really getting the freshest cells, and you're getting them in an ethical way. They're not coming from in vitro fertilization labs. They're not coming from different countries. We do invest in companies that provide us with the best product so that we can provide it to you. All right. And right now with the FDA, they allow us to use the umbilical cord stem cells because we are not manipulating those cells. So when people, for example, they get fat suctioned out of their stomach, and then the doctor puts that fat and gets the stem cells out of it, that is frowned upon by the FDA because you are manipulating those fat cells to extract the stem cells, and that is a problem. So that's what I wanted to drive home, the ethical points and the FDA points in this. So, why would you want to choose stem cells? So, stem cells actually, depending on how severe the issue is, they generally help the patient about 85 to 95% of the time. So it's a high success rate with stem cells. So in our practice, for example, if you come in for a knee injection, we will take a picture of your knee at day 1. We will take a picture of it at 6 months, and we'll take an x-ray of it in 1 year. We have the x-ray machine in our office. So we will be able to track your progress. Having done this now for 2 years, we are seeing about a 90% success rate. And so this does prevent the patient from having to get surgery. Obviously, there's no downtime to this, which is great. And so you don't have to deal with the recovery time of surgery. This regenerates the structure rather than preventing degeneration like steroids do. So you're actually moving up the ladder. You're making the joint much younger. As I mentioned, it does reduce opiate usage because you're actually getting to the root of the problem. And it promotes your own body ability to heal in a natural way. So here's an image of a patient's knees. And you can see on the inside of both of the knees, the joint is very tight. You can see that the two bones are touching. You can see even a little bit misalignment of the knee joint because of that narrowness on the inside of the knees. And if you notice, this is a year, about 15 months later, you can see that inner portions of the joints have totally regenerated. And this was accomplished with one stem cell injection. Now, the thing with this is that we strongly recommend that, it's not like you just do the stem cell injection and you're done. You do need to do some rehabilitation to achieve these kinds of results. So in our part of our treatment plan includes rehab, which we would educate you on so that things are done in a right way. So this is just something I wanted to show you that, a lot of this, as I mentioned, is that if we ever do PRP on you for something like this elbow pain, and the PRP is not strong enough to regenerate what needs to be regenerated, then that would be a time that we could go to doing some stem cells. Because as I mentioned to you, that PRP is kind of limited to soft tissue in general. By adding the stem cell, it would address the bony issues. So this slide kind of shows a combination of where this patient is having a problem with tendons, and then he's also having some issues with the bone, which is the medial epicondyle. And this would be a circumstance where we would have to maybe go from a PRP to a stem cell injection. So I wanted to share with you that the company that we use, there are a few companies out there, but this is the company that we use. It's called Predictive Biotech. And Predictive Biotech is a company that has been FDA cleared, which means that once they have enough research, so they're kind of like in a phase of where this will eventually be FDA approved, but they have at least been FDA cleared so that physicians like me can confidently and safely provide our patients with these different products. So, I thought I would just share that with you. So if you wanted to do a little homework or research on this, it's called Predictive Biotech. And they have some unique products, which I've listed in the next slide. Let's go back here for just a second. Okay, so this was a pretty interesting case that I came across where this patient had a significant disc herniation. It was very large. And 7 months after a stem cell treatment for the disc, it had totally gotten better. Here's another picture of where a patient's hip, if you look on the left side of the screen, the before picture on the top there, you can see that the bone is black and dark in color, which means that the bone is not strong and the surface of it is not strong. And after doing the stem cell injections without doing any surgery, you can look on the bottom left-hand picture that you can see that the bone is stronger, it's brighter in color, and it's healthier. And that was all accomplished through stem cells. So these are the different products of Predictive Biotech that I wanted to go over with you. So CoreSight is the main product when you get a stem cell injection done. So if you decide to go to that website and do a little research, that's the product that has 1 million plus stem cells in it. Now, PolySight is a product that's really great for if some of you get joint injections where you get the gels put in your knees. Those gels traditionally are 6 grams of collagen. The PolySight product has 42 grams of collagen, and it also has regenerative capacities to it. So if you're someone that's ever getting those gel injections, you would be a great candidate for the PolySight, and you would even see more results with that. And then the AmnioSight and the AmnioSight Plus are amniotic products. So I mentioned to you that once the stem cells get into the amniotic sac, they can actually extract amniotic fluid and they take it from the placenta and they can totally sterilize it. It's a 100-step process that they do that. And that has all the building blocks to make a baby. So imagine if you inject these products over different areas in your body, you have the ability to regenerate that. So usually, depending on your case, we would use a combination of these different products depending on what your needs are. So some common uses that we do is the ACL is kind of a tricky ligament that doesn't always do great with PRP, so we'll advance to stem cells pretty commonly. Back injuries, neck injuries, knee pain. Sometimes if you have really severe muscle strains that don't respond to PRP, we'll go to stem cells. Any kind of arthritis in the knees, hips, spine, and shoulder, rotator cuff issues, and ligament and tendon sprains. So here's an example of a hip joint that was pretty advanced, and they did 2 stem cell treatments on this, and within about 15 months, you can see the results of the joint and how healthy it looks. And we see results like that in our clinic. I think I've now done about, I would say, 500 of these cases. And I know the books say 85 to 90%. We're even seeing higher because I think in our practice, we do it, like, for example, before you get the stem cell injection, I would have you take a series of vitamins. I would have you make dietary changes. I would have you reduce any alcohol usage. I would set you up and prime you so that your body is receptive to the stem cells, which I'm not sure a lot of doctors do that. I can only speak for my practice, but I think that gives us that additional 5-7% more results than what's been documented. So this was pretty interesting. I would mention to you about the ACL injuries. And you can see here that if you look at this, when you look at surgery and you look at stem cells and you look at the percentages here, you can see overall that the reductions in pain, the expense, the rehab, and the complications were lower with a stem cell injection than they were with surgery. And if you look at the regeneration, which is in the purple, it's a much higher percentage of the actual ligament being fixed, and rather than just being sewn together. So this is a really nice slide, and there are multiple studies done that show that the pain, expense, rehab, and complications are far lower with stem cell injections. So I'm sorry, this slide is not showing up too well, so I'm going to just skip it. So this is a great image of, if you look on the right-hand side, so I mentioned to you the meniscus, which is a common injury of the knee where the top and the bottom of the knee joint are held together, and that's on the left side. And you can see it's degenerated. It doesn't look like the left side of the slide, but if you go to the right slide, you can see that the two sides are beginning to match up there. So what to expect after a stem cell injection? So most patients, they come in, they do the injection, they feel relief within about 2 to 12 weeks because they're going to feel the anti-inflammatory effects of the stem cells. But the actual regeneration takes longer. It takes 6 to 12 months. So most patients continue to have ongoing improvement, and then they're going to see a reduction in inflammation, and that therefore their pain is going to get better. And through physical therapy, they're going to see an increase in mobility and in function. So the take home is that this is not a quick process after the injection. It's about a 1-year process. And again, this is another hip joint that I wanted to show you. After just 6 months, you can see that the cartilage in the hip is healthier. And because the cartilage is healthier, you get more distance between the joints. So the joint isn't as tight, therefore it's not as arthritic. And I believe this is the final slide, which shows that whenever you do PRP and stem cells, for example, when you do cortisone, which is this green line that's on the bottom, you see that the pain goes down for the first 3 months, but then after 3 months, it generally comes back. Versus with PRP and stem cell treatments, the purple line consistently shows that it's going down as far as the pain. And if you look on the right side, what they did is on the bottom, they put the time of the improvement in the pain. And you can see that with surgery, you don't see quite the results you do with the regenerative processes. So again, I'm Dr. Neil Amin with American Pain Experts, and this is our office number, and this is our email. And this talk is going to be shown on the broadcast on channel 8001. I had done this lecture with your case managers, and through that, I was invited to give this lecture directly to you, to give an opportunity to have some non-surgical approaches to treating your pain. And if you guys wanted to talk one-on-one, Jackie Thompson has, with Life Enrichment, has offered to collect your information, and I'd be happy to do a telemedicine conference with you individually, and we can talk about your individual cases one-on-one. All right, so I'm gonna open this up now. This is my first time doing this, so I'm going to, if you have any questions, we're going to, if you can raise your hand, I will unmute your sound and you can ask the question, and then we'll do that a couple times. Okay, so I'm gonna go to the video screen now. There you guys are. And if you guys, yep, if you have a question, so I'll start out with Jed and Sandy. I see you first. Yeah.
Start there and then you have questions.
Yeah, so I'll ask the one question I already got, which I'll address it. Diane had asked me, how does this relate to orthodisc? So as I mentioned to you, orthodisc is just a synthetic collagen. So it's hyaluronic acid. So collagen is made through hyaluronic acid. So orthodisc itself, I believe, only has 6 to 8 grams of collagen, and that physically separates out the joint. So it's really neat. Like when you come into the office, we take an image of, let's say, your shoulder. We actually put a little bit of dye in there so we can see the outline of the joint. But when we put the collagen in there, you can see the joint physically separate, and the patient immediately gets off the table and is like, wow, this is like, I feel so much better. But the product that's the most similar to the orthodisc is the polycyte, because as I stated, just that 6 to 8 grams of collagen makes such a big difference. That product has 42 grams in it. So it's quite it's a big jump, and it's very effective. All right, so I'm gonna go here to Jed and Sandy. Let me unmute. Oh, just directly on it. Okay, we can hear you now.
So my question is it covered by Medicare and insurance? And then I have another question.
Sure. So regenerative medicine is about 3 to 5 years from being covered by insurances. So one of the things that we had talked about is that the company that we use is FDA cleared. So every time I do an injection on a patient, I send my data to the company. And eventually, as they collect more and more data, it's going to get covered by the insurances.
My second question is, how about the spinal cord? I have some osteophytes. In fact, I had a fusion done, but I'm curious to know, the stem cells, can they regenerate if you had osteophytes? Can it have them, reduce, or, if you have arthritis?
Absolutely. So a lot of times the osteophytes generate arthritis amongst themselves. So they can actually come in contact with not just nerves and other bones, but the stem cells do have the potential of reducing the inflammation and the size of the osteophyte so that it's not as problematic. So any of these products, you can utilize them on different issues. And it's always, to me, in my opinion, worth a try to see if it helps it, and it depends on the location of the osteophyte. That's the important thing. But generally, they're in the back of the spine, which is an easy way for us to access that.
Okay.
All right, thank you. All right, next question. Yeah. So I see Diane Barton.
Yes, since it's not covered by insurance, what's the average, if there is an average cost?
Sure. So PRP treatments per treatment are $575. And that is for the one tube that I showed you. Stem cells are more because it's a series of injections. So the stem cell price includes 3 PRP treatments, which are $575 each. And then in between that, we do the stem cell injection. That series is $4,850. And most of that is because of the cost of the stem cells. They're not cheap. A lot of it's the overhead. But we do it in that series because I learned that if you just do the PRP alone, the stem cells alone, you need that PRP to create a good environment for the stem cells to succeed. So those are our prices. I'm going to go to Jane Middleton.
What's the duration of this treatment? Is it something that you have to repeat every 6 months, every year, every 2 years?
It's a great question. So in the 2 years that I've been doing this, I have not had anybody have to come back. It just depends on where the joint is starting out. Now, the literature says it's 5 to 10 years. So the idea is a lot of my patients that are doing this now are in hopes of it'll be covered by the insurances in the future, and then they're going to repeat it. There's a pretty big movement going on in saying that these regenerative processes are going to get covered by the insurances, because people like me that'll introduce it to you and people will experience it, the word's going to get out. I will say this, like, I'm not a pessimistic person, but I think there's a lot of lobbying going on in DC and things that, we could jeopardize certain fields of medicine. So I do feel there's some component of that why we're being held back for being covered by insurances. But in general, I haven't had anybody come back, but that's just 2 years of experience. With doctors that I've mentored under, they generally say somewhere between 5 to 7 years and maybe 10. Did anybody else have a question? Yeah, I'll go to Diane again.
Diane again.
There you go.
It would seem to me that you would have the benefit of cost on your side as opposed to the surgeries that Medicare is paying for now in those areas of knee replacements and hip replacements. And if in fact your treatments could be a replacement for those replacements.
You would think. I mean, are you asking as to why it's not being covered by insurances now?
Well, are you lobbying with the cost? Medicare is always caring about how much things cost, as they should be. But right. It would seem to me if there's enough comparison information to show that the validity of your treatment and the cost relationship to what surgery would be and the risks of surgery.
That's a great point. It's just that it's new, so we're in that kind of like the vaccine right now. We're collecting data. So we're already showing that it's working. We just need more time. It's a process, and we're just in the middle of the process. It's not that we started this 10 years ago, and the products that come out of the umbilical cord are really only about 1.5 years, 2 years old. Someone figured this out, and it's a home run, but we just need more time. Yeah. Okay. Jed and Sandy?
Do any of these treatments work for nerves tissue? Like if you were, like with my spinal cord, I have pressure on the spinal cord, and so I have some degeneration there, but I'm still functional. Deafness, blindness, anything like that?
Yeah, it doesn't do that. There is a limit to this. So when I have sometimes patients that come to me in desperate situations, and I'm always very upfront and honest. There's these situations that it works, but it's not going to fix something that's as permanent as some of the things that you mentioned.
Thank you.
You're welcome. Is there anyone? Yeah. Any other questions or? Okay, well, I don't see any more questions, so I just wanted to thank you guys for listening. I hope you learned something. And I'm happy to talk to you individually via telemedicine, and Jackie can help us set that up. And if you don't even have to come to my practice, you can just ask me questions. I'm happy to answer it. So was there anybody else? Oh, okay, one more question here. Let's see. Okay, Jed.
You keep talking, I'll come up with more questions. So where is your office, or where is your practice located?
Sure, I'm sorry, yeah. We're right at Oakland and Dixie. So it's a practice called American Pain Experts. And my stem cell practice is called Florida Stem Cell MD. And we're located, it took me 7 minutes to drive here. Yeah. Hi, Carolyn. Carolyn, I'm trying to get your question, but you have to unmute your.
I think I was just waving my hand. I don't
You're good.
I don't have a question.
Okay. Okay. I think we're done. Thank you so much. It was a pleasure meeting all of you virtually. I think we're going to be doing this for a while, so get used to it. All right. Take care.
Thank you.